Doc. Welcome back to the program for this Wednesday as we welcome to the desk good friend of ours who always puts a smile on our face, Dr. Steffany Mohan from Plaza Dental Group, talking about something most interesting this morning.
Yes, we are.
To be honest with you, I haven't heard of it myself. Have you heard of this before?
Well, you kind of said it's brand new to you as well. You just took a trip to California to do the training, which you are constantly doing. And what I love about your place, not only are you fantastic people working there and helping people with their smiles, but you're constantly learning about new techniques that are out there.
Right. I get bored really easily, and I hate it when I can't help people. So it's a bad combination.
So what are we trying to fix here, first of all?
So what we're trying to fix is when people get a lot of recession, their gums will pull back from the teeth, especially in the front, and especially in the top. It happens on the lower arch as well too. But you'll see people that they just have this, we call it recession. So the gums have pulled back from the tooth.
And this is why does this happen?
So there's a couple different reasons. Sometimes it can be actually force, so a bite problem. If somebody has their bite is off, it can actually cause some of that just to have too much force, and it'll cause the gums to retreat. The other thing is sometimes people brush too hard, and sometimes they just kind of have general periodontal disease, just gum problems in general. So there's several different reasons. I mean, most of them are just things that you just don't really think about too much. But when you lose that, you have the tooth surface, the enamel on the teeth, and then you have the root surface. When you lose that gum tissue, the root surface is 7 times softer than the enamel.
Oh, it is.
And so when people get that recession, I know,
it sounds painful, really.
Well, yeah, so it is. It can be very sensitive.
Dangerous, yeah.
It can be kind of the beginning of the end of the tooth because you lose that, and then the root surface is very soft, so people have a tendency to get cavities, and then the sensitivity, and it doesn't look very good either. So there's several different things that really cause the problem, or make it a problem. Yeah.
So what did you learn when you went off to California?
So in the past, what we've had to do is this is going to sound horrible, especially for you, but we've had to take a little graft tissue from the palate, from the behind the teeth. You take a little, cut a little piece of tissue out of the palate and then paste it or graft it, sew it onto the gums. And in the past, it hasn't been very, very effective. It helps, but it doesn't easily solve the problem, and it's painful, and it's surgery, and it can be something that people just really don't want to have done. And interestingly enough, this technique has been around for quite a while, but I had a patient that said, I ran into her at the swimming pool, and she said, I love coming to your office, but I don't want to have this technique done. And I looked online and I found this pinhole gum rejuvenation. Can you just do that? And I said, well, I've been meaning to go, to California and learn how to do it anyway. So yeah, sure, of course. So I mean, sure.
Good excuse to not travel West Coast.
You got homework.
So that's kind of funny the way things happen sometimes.
Right.
And it's a really great technique. It's something that it's non-invasive. It's just you make a little opening in the gum tissue.
Yeah, here's some.
We're going to show you what happens. Make a little opening in the gum tissue, and then kind of almost like shimmy the gum tissue down over instead of the other way around. We've always kind of taken an approach that we kind of go over the top, and now we can actually just kind of move that gum tissue down. So
what does it have, a hook on the end? You pull it down?
It looks like you're knitting almost.
That actually is just measuring. So that's just the probe that when we call out the numbers when you have your teeth.
Oh yeah, 3, 2.
Yeah, exactly.
4.
So that's just measuring the difference between. You can see how long.
That's huge.
How much that recession is there, and then after the surgery, and it's not. We call it surgery, but it's really not. It's just a kind of a little technique procedure.
Wow.
Wow, that much of a difference.
It makes that much of a difference. So again, it's non-invasive. There's a little opening that you make. People, when I went to the course, the guy, we watched a live surgery, and he then came and had lunch with us the next day and was feeling great. He was eating just fine and not having any problem with it and that type of thing. So
how long does it take for the tissue to be permanent and heal up?
Well, so the process really, it's about 6 weeks that you have to be very, very careful. So you don't want to brush too hard or do anything like that
no
for
peanut
about 6
brittle
weeks.
Or anything.
Yeah, no peanut brittle. And then it takes about 6 months to kind of get the permanent result. But it's really like you see it right away. We have to be very careful for that 6-month period, just when all the healing is happening and that kind of thing.
Will it stay then, or will it?
It does stay. It's really amazing. I mean, they have all these studies that we're just starting to do it in our office, but like they have studies that from 8-10 10 years out where it stays. It's amazing.
Wow.
Yeah. So you pull the gum tissue down, and then you actually place collagen membranes along the gum tissue to kind of hold it in place. It kind of,
I was going to ask you that.
Support.
Yeah, as a support, exactly.
Glue.
Yeah, that's kind of the glue, and the collagen then kind of absorbs into the tissue and just holds it in place. So, and that's what's underneath. I mean, that's what our gum tissue is part of too. I mean, we're made of collagen. So, yeah, so it's pretty cool. It's actually kind of a natural type procedure, really, because there isn't anything crazy that we're doing. And again, there's no stitches, there's no scalpel, there's no no cutting, no anything like that.
Now, is this something that is deemed necessary, where insurance might be able to pick some of the cost?
Insurance does pick a lot of it up. It does, yeah. So I mean, it's case by case. I tell people that 20 years ago when I started practicing dentistry, I mean, there were like 5 dental plans, and now there's like 5,000, and there's so many more. So it's very confusing, and it's something that we try and help people to understand their plan and find out if it's going to cover it. But yeah, a lot of times insurance will cover it because it is really important. I mean, that's how we keep our teeth, is to kind of make sure that they're healthy, and this is a way to keep them healthy.
It's a pretty neat deal.
It is.
Yeah.
So
I know.
you have recession. Do you kind of know it? Does it hurt? Is it sensitive?
Yes, a lot of people are very, very sensitive because that root surface doesn't have that enamel covering over it, so it doesn't have that insulation. So a lot of people get especially the younger people are, when they have that recession, they do tend to get very, very sensitive.
Sensitivity.
And those are the people who should talk to you.
Yeah, exactly. And I hate to say this, but we're the only people in Central Iowa that do this.
Don't hate to say it. If it's true, it's true.
I know, but it is. It's true. So, yeah.
You're on the cutting edge.
Thank you.
Yeah.
Well, literally.
So, all right, now people
Except there's not that much cutting.
No.
Now, people want to find out more about this or some other services you might have to offer.
Yeah. Just mainly dmsmiles.com is the easiest way to find us.
Again, I say it every week, but that's a great website.
It is. I know. Well, we love Des Moines, so dmsmiles.com, and just find us that way and give us a call, and we're happy to help.
Perfect.
Yeah.
Awesome. Great. Good to see you.
You too.
It is 20 minutes past 9 o'clock.